9. If someone was unsure on mastopexy with or without implant, would you offer the operation in 2 parts, or do you only perform this in 1? Yeah, absolutely, Atkins. In kind of like the other way around, I would always say to people, there's a lot to be said for doing it in 2 parts. I think, you know, kind of like the standard is doing it in 2 parts, and many surgeons only do it in 2 parts. I think it's kind of, I think most surgeons would do it in 2 parts. Only a few surgeons do it in 1, rather than the other way around. I mean, the people who do it in 1, it's not like they wouldn't do it in 2 parts. I think anyone who does it in 1 would be happy to do it in 2 parts, because it's less risks if you do it in 2 parts. The complications are less if you do it in 2 parts, because when you do a lift, you're making it all tight, and then you put an implant and you're making it tight again. So there is, you know, if someone's saying, oh, you know, I'm not sure, I'm borderline, what do you think? I would always say, we'll do it in 2 parts. Do 1, see if you're happy, get it all healed. 4 to 6 months later, do the other one. Is the cost implication in doing it in 2 parts? Yes, there is a cost implication in doing it in 2 parts. So it is more expensive doing it in 2 parts. There is kind of economy of doing the operation in one go, but the complications are higher, so the risks are higher when you do it in 1 go. And particularly if you're borderline, it might be that you're happy with, you know, if you're borderline sort of, you know, definitely want implants, not sure about the lift, or definitely want lift, not sure about implants, you might be happy with just the lift or the implant. So you might not actually need that second operation, in which case, obviously, it's cheaper. So kind of like a bit of a gamble, because you might not be happy and think, oh God, we should have it done in 1 go. But as I say, in terms of surgery, risks and complications, you're always going to be better off doing it in 2 parts, because you're reducing your risks. But you are putting it over 2 operations, and potentially, if you're, for instance, if you want implants, if you definitely want implants, potentially you're going to be unhappy for that 3 to 6 months, because you're not going to have the volume that you wanted. Or similarly, if you definitely wanted a lift, you're not going to be happy if you have the shape's not right for those 3 to 6 months. So I always have a discussion with patients, and we'll offer it in 1 stage. But as I say, if there is a doubt, there's a lot to be said for just going for it in 2 parts and seeing how you get on. But yeah, good to be aware of everything pre-op, as I said earlier, certainly in terms of cost. So it would be more costly.